Good morning, everyone, and welcome to yet another series of live sessions. Today, we have Dr. Priyanka Chiripal amongst us, and we will be talking about breast cancer awareness. Basically, we'll be discussing myths and facts related to breast cancer. So let me start by introducing Dr. Priyanka first. Thank you, Dr. Priyanka, for sparing time हमारे साथ आज ये conversation करने के लिए. Ma'am, का एक brief introduction. Dr. Priyanka is a gold medalist who completed her oncosurgery training from the esteemed Tata Memorial Hospital, Mumbai. She then went on to do her oncoplasty training from Sloan Kettering, USA, MD Anderson, USA, and Royal Derby in UK. She has been working exclusively for the treatment of breast cancer with the motto of cure with care, compassion, and kismesis. So, thank you, ma'am, for being with us. Um, so, do you want to start with a note like which is starting with the day? So, would you like to start on some note before we get into
Thank
technical questions?
Absolutely. Thank you so much, Kritika, for calling me on this show. I always feel it's an honor to be addressing people, telling them things about breast cancer. And of course, the topic is very close to my heart because it is the most common cancer in women. And I believe that women are the strongest community of the society. So,
Right.
having them healthier is the eventual agenda for all of us.
True, true. We also aspire to, let's say, bring about awareness amongst women and give them right knowledge about their body so that they can make informed decisions.
Absolutely.
So,
Absolutely.
yes. So पहला क्वेश्चन ये कि ब्रेस्ट कैंसर अवेयरनेस की रिक्वायरमेंट आपको क्यों एज एन ऑन्को सर्जन एज अ डॉक्टर आप डे इन डे आउट आप पेशेंट्स से मिलते हैं आप सर्जरीज करते हैं ट्रीटमेंट करते हैं एडवाइस देते हैं तो आपको ये कौन सा पॉइंट है जब लगता है कि हाँ आज हमारी सोसाइटी में हमारे देश में हमारे स्टेट में ब्रेस्ट कैंसर अवेयरनेस फीमेल्स में होना बहुत ज़रूरी है. What is that turning point which you feel makes you
So,
feel that?
basically, there are many reasons why there is this entire cancer awareness drive. So, if you will see, not many cancers have such a aggressive awareness drive as breast cancer. The
True.
main reason being number one, as I said, it is the most common cancer amongst women. Number two, I always tell my patients it's the best cancer to have. Of course, having cancer is not a good disease, but if you are to have one of the cancers, then breast cancer is one of the cancers you can vouch for because
Right.
the outcomes in breast cancer are very good. So, when I say the outcomes are very good, I'm trying to say that it is one of the most curable cancers of all the cancers in the body. Number three, there is nothing we can do to prevent breast cancer. So, if we talk of other cancers in the body, we can always advise something like stop tobacco, stop smoking, stop alcohol. But breast cancer per se does not have any such cause which we can directly address that this is the reason for breast cancer. So that is why the only way to save yourself from the bad or adverse outcome of breast cancer is diagnosing it early. There is no prevention for breast cancer. Practically, we cannot stop it from happening. But if
Right.
we diagnose it in the early stages, then we practically won the battle there and there. And to
Right.
diagnose it in early stages, we need to be aware, we need to know that what causes breast cancer, how does it appear, when do we need to see a doctor and stuff. That is why we are awareness. This incidence has gone up very sharply, and nowadays, we are seeing a lot of advanced cancers, younger cancers. That is what drives us to even more aggressively talk about what is breast cancer.
Okay. Dr. Priyanka, in your last sentence, you had mentioned that the incidence of cancers has risen in recent years. Any specific reason why that has happened?
So, there are a lot of studies going on that, but I personally believe that one of the reasons is that if we talk about 50 years before now, then perhaps people were not that aware, or they were not diagnosed with cancer. It was not that they were not suffering from cancer, but perhaps they were not reporting the cancers. That is one reason why we see an increase in the incidence of cancers.
Hmm.
Of course, the lifespan has increased. Initially people living up to 60 was like an achievement, and now people live all the way up to
Right.
100. So cancer is a disease of old age. So as the life expectancy, the lifespan increases, we are bound to see an increase in cancers. Plus,
Right.
specifically for breast cancer, we see in the Western world, like in United States, the incidence is even more. It's like perhaps 3 times more than what it is over here.
Hmm.
In that case, I would say that westernization, modernization, lifestyle, stress, obesity, our food habits, all this has contributed to breast cancer. I am not saying that directly the reasons for breast cancer, but
Hmm.
somewhere gradually, bit by bit, they are adding to the increase in the incidence of breast cancer.
Right, right. So lifestyle changes, and of course, because now the medical science is advanced, people are becoming little more aware than what they were, let's say, 20 years ago. The cases are now
Absolutely.
being reported. Otherwise, I think people used to, if you ask people who maybe expired before, let's say, like before 1990s, in 70s or
Yeah,
80s, they don't even know the reason why their loved ones died. Maybe
exactly.
because there was no access to healthcare, proper healthcare in their vicinity, or they
That is
didn't
one
even
thing,
know.
and that is one thing, and the other thing is, we as women are so shy about talking openly about this thing, that
Mm.
perhaps I know so many people in the nearby vicinity who had a lump in the breast but did not have the courage to come up and talk about it to their family members.
Right,
In fact, I
right.
will tell you, in the initial years of my training, 10 years before today, when I used to talk to my family also about breast cancer, and I used to say that, this is what causes breast cancer, this is the way we should be talking about or thinking about our bras, everybody would look around and they were like, can you go a bit low? You're talking about breast and the bra.
Mm.
So, that is how the mindset was, at least then. And I'm hoping it is
Right.
changing now. Yeah.
Right, right. I mean, surely, like people are at least in the digital space, they are getting more aware about these things. And recently, I mean, we do a lot of off-ground work. We've seen ASHA workers who are
Yeah.
now also being told and trained how to, talk about self-breast examination with women.
Absolutely. You're
Of
talking
course.
about ASHA workers. A
Hmm,
lady who comes to give me the massage, like, that lady we just call on
hmm,
freelancing basis just
hmm,
for a
hmm,
quick massage. Even
hmm,
she actually ended up asking me that, Madam, you're a breast cancer surgeon. So, I
hmm,
tend to do 10 massages a day. If you could teach
hmm.
me how to examine the breast, maybe, I
Yeah,
can tell my clients. And that is
right,
where the society is changing. We have
right.
had ladies in the last 5 years who come up and say that, I didn't feel it, but the lady who was giving me a therapy told me that, something feels abnormal. So can you just
Something.
go and show a doctor?
Right, right, right. I think that's a very good mindset shift
Yeah.
that is coming up, and I think with the continuous efforts like this, ये और आगे बढ़ेगा मतलब एक
बढ़ेगा
पॉजिटिव
बिल्कुल.
डायरेक्शन में बढ़ेगा.
Absolutely.
सो
Absolutely.
एक बहुत ही बेसिक सवाल जो ये वीडियो कोई भी आज देखेगा 1 साल बाद देखेगा ये क्वेश्चन बहुत रेलेवेंट है कि रिस्क फैक्टर्स क्या है क्योंकि
Yeah.
आपने कहा कि इसको हम प्रिवेंट नहीं कर सकते जैसे
Prevent नहीं
एचपीवी
कर
या
सकते.
सर्विकल कैंसर के केसेस में है कि आज आप वैक्सीनेशन ले सकते हैं जो कुछ
Yes.
92% एफिकेसी है बट इट्स समथिंग
Absolutely.
राइट
Absolutely.
with breast cancer वो हमारे पास अभी चॉइस नहीं है there are
नहीं
no
है.
vaccinations available also a lot of it is genetic in nature as
Yeah.
well
Yeah.
तो
Yeah. Yeah.
आप
Yeah.
क्या कहेंगे कि एक एक
So,
फीमेल को क्या रिस्क फैक्टर्स हो सकते हैं
if we talk about the risk factors, theoretically, I can go on and on with a list of, say, 20, 25 risk factors. But I will start off saying that 70%, 70% of breast cancers do not have an underlying cause. So,
Okay.
in retrospect, if we happen to see all our breast cancer patients, in 70%, we cannot, not nobody in the world can tell what was the cause of breast cancer in this patient. For the remaining 30%, yes, of course, we do have causes like hereditary, which you said is
Right.
genetic. It has been running in the family from generation to generation.
Hmm.
Their sisters, mother, paternal aunts, maternal aunts, they have been suffering from some kind of cancer. So there is a genetic problem which is just running in families. The other cause for women is, of course, age, being women, that all increases a risk factor for breast cancer, but menstrual exposure. So we say that, if your menstruation started
Mhm.
pretty early in your life and it continued, your menopause came pretty late in your life, so you had a longer active menstrual period, that increases
Mm.
your risk for breast cancer.
Okay.
Of course, theoretically, not having kids, having less kids, not feeding them, all that add to the risk of breast cancer. But talking about India, we practically see women with 3, 4 kids who have been fed for 2, 3 long years. So
True.
I don't even think that actually contributes, but that is theoretically a risk factor. Obesity is a very important risk factor. So it's very important to stay healthy, stay active.
Mhm.
Stress, which I believe is a bit overrated these days. So if you ask any third or second, perhaps younger generation kid, they are talking about stress. So I believe this entire stress thing has become more of a. I mean, if you talk about our parents, I think they did 100 more things than what we are doing right now without
Right.
even complaining.
True.
So
True.
I think this all entire agenda about being vocal for your stress has all the way increased the stress, because now people say, oh, I'm really stressed. That has become a
Right.
style statement, but we will not get into that. So yes,
Right.
stress, obesity, hereditary, menstrual exposures, all this add to your risk factors for breast cancer. But as I said, 70% do not have a cause for breast cancer. So
Right.
the cause really is not that important or that material as far as breast cancer is concerned.
Right. Basically, what I can summarize is that if you are a female, you are susceptible to breast
To
cancer
have
at
breast
any point
cancers.
of your life. इसीलिए
Absolutely.
जानकारी रखना, ब्रेस्ट एग्जामिनेशन रखना, मंथली
Is
करते
very
रहना
important.
बिफोर योर
Yes,
menstrual cycles
yes, yes,
happen,
yes,
बिफोर योर periods come. ये
yes,
सब
yes,
ज़रूरी है.
absolutely.
जब हम सेल्फ ब्रेस्ट एग्जामिनेशन या सिम्टम्स की बात करते हैं कि जब आप ये सिम्टम्स ऑब्जर्व कर रहे हैं, तब तब दैट इज द पॉइंट आपको डॉक्टर के पास एग्जामिनेशन के
जाना
लिए
रहेगा.
जाना चाहिए. वो कौन से
Exactly.
सिम्टम्स हैं जिसका
So
ध्यान
basically,
रखना?
the very important question, because the common myth is that breast cancer is painful. So
हम्म.
that is a very big myth,
ओके.
because if the patient is walking up to my cabin and telling me that I'm in a lot of pain, there and there in my heart I know that fortunately the patient is not suffering from breast cancer. So very important to remember that breast cancer is usually painless. The most important symptom is a lump. It is a गांठ, जिसको हम बोलते हैं ब्रेस्ट में एक गांठ फील होना. So it is a lump, which is the most common symptom of breast cancer. It is not pain.
राइट.
Apart from the lump, you can feel the lump in your armpit also. So sometimes what happens is that instead of breast, you happen to tend to feel the lump in your armpit before feeling it in the
राइट.
breast.
योर समवेयर स्टार्टिंग फ्रॉम
Yes,
हियर.
yes, yes, yes. Apart from that, nipple में से discharge आना. But when I say nipple में से discharge, then yellow, green, black, white, they are all normal discharges. The
ओके.
worrisome, the alarming discharge is red blood stained nipple discharge. So अगर red blood stained nipple discharge है, lump है, ऊपर की स्किन में थोड़ा सूजन है, आपको थोड़े दाने दाने नजर आ रहे हैं, ब्रेस्ट का साइज सडनली एक साइड का बढ़ने लग गया है, थोड़ा बहुत डिफरेंस दोनों साइज में ऑब्वियसली नेचुरल है. But if there's a
राइट.
sudden increase in one of the side of the breast, they are the reasons why you should urgently go and see your doctor.
राइट.
Remember, सारे lumps cancerous नहीं है, ऐसा नहीं है कि गांठ है मतलब कैंसर ही होगी, but you need to visit a doctor. How will you come to know कि आपकी breast में कोई गठान है? So that brings us to the most important 2 minutes of this session, which is breast self examination. ब्रेस्ट
राइट.
सेल्फ एग्जामिनेशन यानी खुद की ब्रेस्ट को खुद फील करना है आपको. आपसे अच्छा आपकी ब्रेस्ट को कोई नहीं जानता है. सो यू एंड ओनली यू कैन फील इट एंड नो इफ देयर इज एनी चेंज. उसके लिए
राइट.
आपको दिमाग में थोड़ी चीजें रखनी है. यू शुड नेवर फील योर ब्रेस्ट जस्ट बिफोर योर पीरियड्स. पीरियड से पहले हमारी ब्रेस्ट में पेन होना, छोटी छोटी गठाने होना बहुत नॉर्मल है, स्वाभाविक है, बिकॉज दे आर ऑल हार्मोनल चेंजेस. सो दे आर नॉट सिम्टम्स ऑफ ब्रेस्ट कैंसर. यू हैव टू फील योर ब्रेस्ट इन द मिडल ऑफ योर साइकिल. मतलब आपके पीरियड्स फिनिश हो जाते हैं, उसके नेक्स्ट वीक में आपको अपनी ब्रेस्ट फील करनी है वंस इन 3 months. आजकल ब्रेस्ट कैंसर का फियर इतना हो गया है कि पीपल कीप ऑन फीलिंग देयर ब्रेस्ट एवरी अदर डे. सो वैसा नहीं करना है आपको. 3 महीने में एक बार अपना ब्रेस्ट फील करना है जस्ट आफ्टर योर पीरियड्स आर ओवर. यू नेवर फील योर ब्रेस्ट विद अ पिंच. कभी भी पिंच करके ब्रेस्ट को फील नहीं करना है, बिकॉज ब्रेस्ट में चर्बी इतनी रहती है कि आप पिंच करोगे तो यू विल टेंड टू फील दैट देयर इज अ
फैट आ
लंप.
जाएगा हाथ में.
फैट आ जाएगा. सो
राइट.
व्हाट यू हैव टू डू इज यू हैव टू यूज 3 fingers और द फ्लैट ऑफ योर हैंड. सो या तो आप 3 फिंगर यूज करो, या यस दिस वे, या तो आप पूरा फ्लैट हैंड यूज करो. स्टार्टिंग फ्रॉम योर कॉलर बोन यू हैव टू फील योर एंटायर ब्रेस्ट इन सर्कुलर मोशंस. आपको कोई भी छोटी गठान है तो आपकी उंगलियों के नीचे फील होगी. एक
राइट.
बार आपने पूरा ब्रेस्ट फील कर लिया है, उसके बाद आपको निपल प्रेस करके देखना है कि उसमें से कोई प्रकार का लिक्विड आ रहा है या नहीं आ रहा है. If you feel anything in your breast self-examination, that is when you go and need to show a breast specialist. Breast
Right.
self-examination once in 3 months. एक बार एक्सपर्ट के पास साल में एक बार अपना ब्रेस्ट चेक करवा लेना चाहिए, बिकॉज थोड़ी बहुत चीजें ऐसी हैं आर्मपिट में या उसमें जो आपको ना फील हो लेकिन हमें फील हो जाए. तो बेटर है कि साल में एक बार आप हमसे चेकअप करवा लें. एंड इफ दिस ऑल शुड स्टार्ट एट द एज ऑफ 25. 25 साल की उम्र से आपको ये चीज शुरू कर देनी है, बिकॉज ऐसा नहीं है
Right.
कि कैंसर बड़ी उम्र का रोग है. In the history of the world, the youngest breast cancer patient was 9 years.
Oh, 9 years
Yeah,
old.
and 9 years. And the youngest
That
patient I
that's
have
like
personally treated, personally,
prepubescent in many cases.
prepubescent, exactly. So the youngest patient I have treated personally is 13, 1-3. So a 13-year-old girl walks in your cabin, you're not even in your dreams or nightmares thinking that, she could be suffering from breast cancer.
Breast cancer.
So there is
Right.
nothing like it starts at a later stage. In fact, recently, you'll be surprised, I've been seeing a lot of patients in the age group between 30-35 during their pregnancies, during their feeding. So breast self-examination once in 3 months, get your breast checked by an expert once a year.
Right. I think we lost Dr. Priyanka for a while.
And once you have... Yeah, I'm sorry, I think there was some trouble connecting.
Yes, yes.
So
We
other
lost you for
mammography,
like
yeah,
few
a couple of
seconds there.
seconds. Yeah.
I think,
So
can
other
you repeat your
mammography, I'll
last two
repeat from
sentences?
mammography. I'll repeat from mammography.
Yes.
So a mammography is to be done once you cross the age of 40. If not every year, at least once in 2 years. A mammography is a very simple X-ray of your breast. It is not that painful. I will not say it is painless, but it is not that painful. It is a procedure where your breast is pressed between two plates and a simple X-ray is taken. I'm often
Right.
asked in my talks के इससे कितना radiation मिलेगा. I just laugh it out saying that in today's
Exactly.
generation, perhaps the young beautiful women take that much exposure in one day from their mobile phones. So you
Oh,
better not worry about the radiation you're getting from a mammography. It's not harmful. You can very
right.
safely undergo a mammography once in a year to once in a 2 years. So self breast examination, clinical breast examination, and a mammography. These three things, if you are very religious about, trust me, you will diagnose breast cancer at a pretty early stage where you're not going to end up losing a single minute of your life.
Right.
That brings me, I am sure that was one of your questions, Kritika, but I'll still just continue in the flow and tell you that
You
brings
you
me...
are in a good flow. I'm not going to disrupt your flow.
Perfect. So that brings me to the stages of breast cancer. And normally कोई भी cancer होता है उसके 4 stage होते हैं. But breast cancer is a fortunate disease to have 5 stages. And why it is fortunate? Because 5 stages does not include 5th stage. It includes a stage 0. So in breast cancer, we have a stage 0 where cancer has not even practically gone out of the cells. But we can still pick it up with the mammography. So तब गांठ
Right.
नहीं बनती है, कुछ नहीं बनता है, लेकिन mammography पे we can pick up. We call this precancerous stage 0, and there the cure rates is practically 99%.
Right.
Once there is a lump in your breast, it is stage 1. Once that lump is bigger than say an inch, it is stage 2. Once the lump has gone to your armpit, so armpit is the first area where the breast lump goes. So if the cancer has gone to your armpit, it is stage 3. Till there, it is
Right.
still curable with a little lower rates, but curable. एक बार ब्रेस्ट कैंसर आर्मपिट को छोड़ के बॉडी के अलग ऑर्गन्स में चला गया है, यानी लंग में, लिवर में, बोन में, ब्रेन में, then practically we cannot do anything about it.
Yeah.
Then practically it is stage 4. That is
Right.
what we want to stop. So we keep on telling our beautiful ladies that please touch your breasts, feel them, and try and come at an early
Right.
stage so that we can do something about it before it's
Right.
late.
That brings me to what you said in the beginning of the talk कि लोग जब अर्ली डायग्नोसिस या एक अर्ली स्टेज पे आते हैं तब उनकी ट्रीटमेंट करना और वो ट्रीटमेंट का सक्सेसफुल होना उसके चांसेस बढ़ जाते हैं. सो
Right.
एवरीबॉडी हु इज वाचिंग दिस वीडियो जस्ट इट्स एन अपील कि आप और आपके आसपास जितनी भी फीमेल्स हैं आपके फैमिली में आपके फ्रेंड सर्कल में उनको मोटिवेट करिए कि अगर वो स्लाइटेस्ट चेंज शायद वो चेंज कोई ज़्यादा it can be just a normal hormonal change but even if you
Absolutely.
witness any small change in your breasts आप प्लीज
There is
तुरंत
no harm in
डॉक्टर से
showing.
कंसल्ट करें. देयर इज नो हार्म इन शोइंग. आज के डेट में जैसे आपने कहा कि बहुत सारे ट्रीटमेंट ऑप्शंस हैं और सक्सेसफुली आपने 13 साल से लेके
95.
बहुत बड़ी एज के, हाँ, बहुत बड़ी एज के लोगों को भी आपने ट्रीट किया है
Yes.
और वो
So,
ट्रीटमेंट सक्सेसफुल
one
है.
more positive change in the society. When I was a kid, for me, kitty parties of these older ladies meant they will just sit, gossip, eat, and come back. But in the last 7 years, we've been seeing these women of kitty parties. They form a group and they come down for their mammographies.
Right, right.
And they,
That is
actually
such
invite
a
us. Yeah,
big
yeah.
mindset change, right?
Big mindset change. Yes.
एंड आई थिंक ये सारी फोरम्स में एक जो बॉन्ड क्रिएट होता है फीमेल्स के बीच में, वहां पे ये राइट चीजें हैं इस तरह की बातें करना. एंड दे आर सो ओपन, दे बेयर देयर
Yeah.
हार्ट एंड सोल इन फ्रंट ऑफ देयर फ्रेंड्स
Absolutely.
ऑन दीज
Absolutely.
प्लेटफॉर्म्स.
Yeah.
तो आप मजे करते करते भी अपने फ्रेंड्स के साथ एक चेकअप कर सकते हैं. हु
Absolutely.
नोज आपकी एक बहुत बड़ा लाइफ
I
चेंजिंग.
always tell them, plan your next kitty party or picnic to a mammography center. You can sit there, have fun, but just get a mammography done. Anyway, that's fine.
राइट,
It's immaterial where you get it done. Can we
राइट.
actually, I cannot see the questions people are posting. But if you see any questions, we can take them in between so that they
Yes.
get the immediate answers.
Yes, yes. Not there is a myth which somebody has posted in the query section where maybe wearing a bra for too long hours can increase breast cancer. I think this is a point where you can come with your
Yes.
expert wali
So,
study and do mythbusters.
I always ask my audience very laughingly that, what do you think, which color bra is the most susceptible to cause breast cancers? And you'll be surprised, it's a unanimous answer. Like if I ask
Hmm.
you that, Kritika, आपको क्या लगता है? Audience ने क्या जवाब दिया होगा?
ब्लैक ही बोला होगा बिकॉज ये
Exactly.
हम
So it
काफी
is like a
फोरम्स में
such a
मैंने भी देखा
loud,
है लोग.
yeah, it is such a loud voice answer. Black, black, black. So I'm like, what were you thinking? कि bra companies ने सोचा यार breast cancer बहुत कम हो गया है, चलो थोड़ी black bra बनाते हैं और
बढ़ा
breast
देते
cancer
हैं.
बढ़ा देते हैं. So of course, you need to understand that bras are something we wear to support our breasts. So
राइट.
basically, breast is a hanging organ. And because of gravity, it is tend to pull it down, which can cause shoulder pain, back pain, and everything. तो ब्रा का काम सिर्फ इतना है, वो ग्रेविटी को एलिमिनेट करके उसको ऊपर हैंग करके रखना है, so that there is no pain in our breast. So
राइट, सपोर्ट
anything,
देना है
anything
basically.
support देना है. Anything that you do outside your breast, may it be talcum powder, may it be deodorants, may it be bras, cannot cause breast cancer. हाँ, wrong bra से आपको breast pain हो सकता है. So वायर्ड ब्रा, पैडेड ब्रा, ब्लैक कलर ब्रा, कोई भी फैंसी कलर का ब्रा, दिन भर पहनना, रात भर पहनना, इन सब चीजों से कैंसर का कोई लेना देना नहीं है. आई एम ऑफन आस्क्ड दैट is it okay to wear your bra at night? And I say I have been wearing it for last 25 years like after I started wearing my bras. It is a matter of comfort. If
राइट.
you're comfortable putting it on a night, please put it on a night. If you're not comfortable, it is okay to remove it at night because there you're lying down and you're already eliminating the gravity. So simple logic है, आपकी comfort के हिसाब से आप पहन सकते हैं. लेकिन yes, if you are working out, if you're gymming, if you're jogging, then please wear a well supported sports bra, because otherwise you'll end up with a lot of breast pain. It's still
Right,
not going to
right.
cause breast cancer, but it can cause a lot of breast pain. So yes,
Right.
all said and done, nothing. You cannot do any. I often ask that, लोग बोलते हैं कि heat, like गर्मी से बहुत breast cancer बढ़ जाता है. So I said, and how do you think that is possible? मतलब तो बोले नहीं, अगर तुम black bra पहन के धूप में जाओ या तुम स्टव के पास खड़े होके खाना बनाओ.
Right,
So
right.
I said this is a very nice reason if you don't want to cook food at home, and you can tell your mother-in-law that नहीं मैं इस गैस के पास नहीं जाऊंगी बाबा, मेरे breast में cancer हो जाएगा. But honestly ऐसा कुछ नहीं होता है. All this is just causing some skin changes in your breast at the most. जिनको perspiration problem रहता है उनको थोड़े follicles हो जाते हैं. But nothing you do on the outside can cause breast cancer.
Right. Even जो आपने अभी deodorants mention किए, वो भी हमने एक common myth सुना है कि
So
deodorants लगाने से if you
the
perspire a
only
lot.
how did it start? This all started because ये जो talcum powder होता है ना, उसको लगा के तुम स्टार्टिंग में मैमोग्राफी करते थे ना, तो there was a misinterpretation in the mammography report because of the calcium that
Okay.
was on your skin.
Right, because
So
of
I
the
think
talcum powder.
so I think somebody somewhere must have mentioned that, and that has been carried away too long, and people have started assuming that causes breast cancer. No talcum, no deodorants can ever cause breast cancer. So it's all absolutely safe to use.
Right. आपने ऑलरेडी एक और मिथ था जो एक एक्सरे को लेकर था कि
Yeah, exposure of
मैमोग्राफी
radiation.
या ब्रेस्ट सोनोग्राफी जो होती है,
Yeah,
बिकॉज मैमोग्राफी के बाद आई थिंक इफ दे आइडेंटिफाई समथिंग देन द नेक्स्ट स्टेप इज सोनोग्राफी.
yeah,
सो
true.
दैट इज ऑल्सो वन थिंग कि जो आपने ऑलरेडी सॉल्व कर दी. मैं अपनी ट्रीटमेंट ऑप्शंस की तरफ जाना चाहूंगी कि लेट्स
Right.
से इफ यू अगर आपने डायग्नोसिस कर लिया है
So, when
मैमोग्राम
somebody comes,
सोनोग्राम में, तो आगे क्या स्टेप्स होता है
so
फॉर अ
somebody
डॉक्टर?
comes with a breast lump to us, they will usually tell कि एक छोटी सी गांठ है, कुछ तकलीफ नहीं दे रही है, कोई पेन नहीं दे रही है, but as I said, painless, non-harmful appearing lumps can be cancerous, and they are usually cancerous. So then we send the patient for a mammography and a sonography, and once on that also we find the things equally suspicious, then we do a biopsy. So another common myth is biopsy मतलब क्या होता है? It's like a simple blood test, but it is in the lump. एक छोटी सी सुई हम गांठ के अंदर डालते हैं, वो उस गांठ में से एक छोटा सा टुकड़ा लेके हम बाहर आते हैं, जिसको हम एग्जामिन करते हैं. दिस इज कॉल्ड अ बायोप्सी. एंड ट्रस्ट मी, कैंसर कोई कीटाणुओं का या जीवात का झुंड नहीं है जिसमें आपने एक सुई डाली तो वो सब उड़ के तितर बितर यहाँ घूमने लग जाएंगे. दैट इज अ वेरी कॉमन
राइट.
मिथ. सो बायोप्सी डज नॉट स्प्रेड कैंसर. ऐसा नहीं है कि एक बार आपने कैंसर को छू दिया है तो अब वो पगला गया है और अब आपको इमिडिएटली कुछ कर देना पड़ेगा. बायोप्सी इज अ नॉर्मल सेल विच इज ग्रोइंग इन एन एक्स्ट्रा अमाउंट ओवर देयर, और वो एक्स्ट्रा
राइट.
सेल्स ने वो कैंसर कर दिया. उसमें बायोप्सी करने से कोई कैंसर नहीं फैलने वाला है. दैट इज द ओनली वे टू डायग्नोज ब्रेस्ट कैंसर. Your biopsy reports will come in within 24 to 48 hours in good centers. It might take a little longer in smaller centers, but for 24 to 48 hours, you will know, okay, okay, I'm suffering from breast cancer. Then we will do some reports to see what stage it is, which I explained you, staging of breast cancer. तो एक PET
राइट.
scan करते हैं
जीरो
अगर
टू
जरूरत
फोर
है. 0 to 4. So then by doing PET scan, or if PET scan is not required, then we do simple tests like X-ray, sonography, and we try to find out that what stage of breast cancer are we dealing with. Then the treatment options differ. Normally, for any cancer, for any breast cancer, the options available to us are surgery, chemotherapy, radiation, tablets, and targets. ऐसा नहीं है कि सबको पांचों पांच ट्रीटमेंट मिलने वाली है. It differs from patient to patient. If at all your surgeon tells you, or if at all your cancer specialist tells you that your case is the one which requires surgery first, then we start off with a surgery where, let me be very clear, flat chest is no more the only option. ऐसा नहीं है कि कैंसर है मतलब ब्रेस्ट निकाल देना पड़ेगा. 90% पेशेंट्स में हम ब्रेस्ट बचा के सर्जरी कर सकते हैं. केवल
राइट.
गांठ और बगल की गांठें, बिकॉज जैसा आई हैव बीन टेलिंग, आर्मपिट इज द फर्स्ट स्टेशन ऑफ ब्रेस्ट कैंसर. सो केवल गांठ और बगल की गांठें निकाल के भी हम कैंसर को उतना ही अच्छा या शायद थोड़ा ज्यादा ही अच्छा मिटा सकते हैं. सो पूरा
राइट.
ब्रेस्ट निकालने की जरूरत नहीं रहती है. 90% में हम ब्रेस्ट बचा के ऑपरेशन कर सकते हैं. जो 10% पेशेंट्स ऐसे हैं जिसमें हमको अनफॉर्चुनेटली निकालनी ही पड़ती है, उसमें भी अब साइंस इतना आगे आ गया है कि वी हैव अ लॉट ऑफ ऑप्शंस ऑफ प्लास्टिक सर्जरी इन टर्म्स ऑफ इम्प्लांट या खुद की चर्बी यूज करके. पर वी कैन मेक श्योर दैट अ विमेन ऑलवेज लिव्स विद हर एंटायर इंटेग्रिटी मेंटेन्ड. ऐसा जरूरी नहीं है कि आपको एक चेस्ट फ्लैट करके जीना पड़ेगा. बराबर. सो दैट इज अबाउट सर्जरी. देयर इज अ लॉट मोर डिटेल्स, बट आई गेस सुपर
Yeah, I think we don't go in a lot of technical details. I think
is.
I lost you.
Yeah, so this is about surgery. Some patients require chemotherapy first. Chemotherapy में हम normally क्या होता है, या अगर हम पहले दे रहे हैं तो हमारी इच्छा ये है कि वो कैंसर की गांठ थोड़ी छोटी कर दे हम कीमोथेरेपी देके, so that then we can treat it in a better way. Other patients के बाद सर्जरी के बाद उनको कीमोथेरेपी देते हैं. Chemotherapy is a simple injection which is given into your veins through
Right.
fluids. After that comes radiation, which is a superficial X-rays given to the breast, and that is radiation. Okay,
Right.
so this is a short summary of what the treatment options are. As I
Modes
said,
of treatment for breast
yeah,
cancer.
modes of treatment for breast cancer. As I said, 90% of the patients can get away without removing the breast. But that brings me to a very important session of my talk, which is what if we ended up removing.
I think we lost you again. Let's see if we can reconnect fast. Dr. Priyanka, can you hear me? Uh, Dr. Priyanka, can you hear me? Dr. Priyanka, can you hear me? You're on mute. I think you're on mute. You've
Fine
gone on
now?
mute.
Yeah,
Yes,
yeah,
yes.
yes. There is some issue with the network.
Good.
So basically, that brings me to a very important section of my talk where I say that, agar for whatever reasons, your choice or my insistence, but you end up removing a breast. So there are two things that happen. One is of course कि flat chest है तो कहीं ना कहीं breast cancer से तो आप ठीक हो ही जाने वाले हो, but lifetime you will keep on seeing yourself in the mirror and feeling that I've lost some important organ. Uh,
बॉडी इमेज काफी सफर करती है
body image
काफी.
काफी suffer करती है. Yes. And the second thing that happens is, like one side the breast is there, the other side the breast is not there. So what we don't realize is our body tends to turn towards that side. That causes back pain, upper back pain, shoulder pain, and spine में भी थोड़ा unevenness आ जाता है. So for that we do have an option where we can always tell our patients that if you have had your breast removed, then you can always use an external implant. This is a prosthesis,
Okay. Okay.
and this
It
prosthesis
looks
can be,
completely like, how your
yeah,
normal
yeah.
breast would look like.
And what is the good part is that this can be customized, so the weight of it can also be made in such a way that it can match to your opposite breast.
Okay.
And
Okay.
this is given with this is given pre-fitted in your bras. So you will get
Okay.
a set of it which is in the bra, which is very easy to wear, and then that will help one gain your confidence with body image, and number two, it will also help with those shoulder pains and back pains with certain patients with breast flat chest can have.
Right.
So
Right.
I always insist that this is not only for cosmesis. Don't wear it just as a cosmetic part that bahar jana hai saadi pehni hai to pehn liya. Make it a habit that if for any reason you've had a flat chest, then make it a habit to wear it in a routine every day.
So that both your breasts, if they are balanced, ये बहुत important चीज आपने बोली.
Yeah,
This because you're
exactly.
talking about breast cancer, but even apart from that, a lot of females, because there are different movements that come along, pre-the-nipple
Yeah,
movement, etc. For a lot of female bearing breasts, actually supports their,
it does.
especially for heavier females or women
It
who
does.
have
It does. It
they're
does.
heavier on their breasts. It
Yeah,
helps support and align their spine
yeah,
and not
it does.
droop their shoulders also. So I
So
think ये जो आपने processes दिखाया, it is a very good
helpful.
alternative for females who are maybe they have to
Flat
remove
chested
their
or
whole
yeah.
breast during
Yeah,
the
yeah.
treatment.
And
Right.
nowadays people are undergoing a lot of breast reductions also. So again, the reason
Okay.
being that heavier size of breast it starts causing them a lot of back pain and stuff.
Right.
So it
Right.
has now I think अभी ये सब चीजों का awareness काफी बढ़ रहा है.
राइट राइट. और
Yeah.
ये बॉडी इमेज एक बहुत बड़ा इशू. और जैसे आपने कहा कि देयर आर गर्ल्स as young as 13 or who are young in their early 20s or in their
Hmm.
20s 30s, which is, let's say, prime of your reproductive or sexual life.
Absolutely,
This
absolutely.
can be a very good option for those females who do want to, even elder females. I think body
Even
image
elders.
for
In fact,
somebody,
younger females,
everybody.
though, yeah, for younger females, though, I believe we should do a reconstruction only. Like, they
Right,
should live with a naturally created breast so that lifetime ka tension nahi hai. But for those people
right.
who cannot afford a reconstruction or because
Yeah.
of age, they are a bit skeptical about undergoing a plastic surgery, then for them, this is a very good alternative.
Right, right.
Yeah, yeah. I
Uh,
think now we can move on to the question section. If anybody has any questions, we
we
can take them.
okay, we do have one question. Where
Mm-hmm.
they're talking about increasing incidences amongst women who are 30 to 35. But I think we've covered it. But you want to add something to it that
No, so
uh,
basically, as I
women in
said, that
their
it's
30s
a
and 20s.
yeah. So as I said, it's a shift in the lifestyle, more awareness, and everything which is causing early breast cancer. It is very important for us women to understand that pregnancy में है ना, हमारे
Hmm.
breast में बहुत सारे changes होते हैं. That is
Okay.
that, and feeding is the time when we tend to miss breast cancer because no matter whatever you say, घर में लोग बोलेंगे pregnancy में होता है, breast में ऐसा भी होता है, ऐसा भी होता है.
Change
So
होता
I
है या
always say
changes
that
होता
yeah, so I always say that don't ignore them as natural pregnancy or feeding changes. If in doubt, just go and show once. There is no harm. The problem in our mindset is like if I tell my mom that, mom, it's time to get a mammography done, her worry is mammography में कुछ आ गया तो. I am saying don't fear what is going to happen? The tool has been made because we can pick up things when they are curable. So वो सोच के आप उसको delay मत करते रहो. Just go visit, get a mammography done. If there is something you are pretty in an early stage, and we can help you out of it like completely.
Right. Another question that I personally want to ask is there any genetic testing available today, and should that be an option? क्योंकि अगर there are always two types of people. एक जो है जो बहुत बड़ा chunk है, जो even mammography से भी डरता है, शायद वो breast self examination जो monthly करना है, वो कभी करेगा कभी भूल जाएगा. But there is also another group, and at least among young millennials and Gen Z people, that group is increasing because increased exposure of internet. So is there any option like genetic testing या
So
फिर वो नहीं करवाना चाहिए क्योंकि आप
so I was
already
coming
करेंगे
to
तो
that.
उसमें आ जाएगा.
Exactly. So if you ask my personal opinion, I'm not backing up this by any big study or evidence, but if you ask me, genetics is not a major cause of breast cancer, number one. Number
Okay.
two, there is a test available. Yes, BRCA. BRCA is the gene which can be detected. So if you know that, Angelina Jolie underwent the BRCA testing and she was positive. BRCA is a gene that can be detected, but then having BRCA does not mean I will definitely have breast cancer.
Okay.
So even without any risk factor, just because the fact I'm a female and I have two breasts, my risk of breast cancer is somewhere around 17 to 18%.
Right.
Having BRCA positive, of course, increases it to 40%.
Hmm.
But then that is, what you say, too much knowledge is harmful type of thing.
Too
Then
much.
you're constantly living in the fear of breast cancer. So I am not a very strong propagator of BRCA testing. It is definitely not a test for mass population. But even if you know you are BRCA positive, the question then boils down to what are you going to do about it? And I say, even if you're BRCA negative, you still have to undergo a breast self examination, an examination by an expert, and a mammography. So it's
Okay.
good to know if you can digest that knowledge that, okay, fine, I'm BRCA positive, it means there is a slightly more risk of me getting breast cancer. And if that does not cause a mental illness to the level of panic, then yes, it is good to get tested.
Right. I have one more myth which I would like to address with you. People say that women who have undergone certain sort of hormonal treatments as part of their, let's say, a lot of young
Infertility.
girls do not want to undergo their PCOS or thyroid or
Yeah, yeah,
infertility
yeah,
treatments
yeah, yeah, yeah.
because there is an ingestion of artificial hormones like a combination hormone pill होती है progesterone pills. So, does IVF or any sort of hormonal treatment that you have undergone to, let's say, regularize your menstrual cycle or for regularizing your ovulation patterns, does that make you susceptible to breast cancer?
So basically, it's usually given in a very guarded dosage. So normally, this stimulation is done in such a guarded way that it does not reach up to the level where it is actually increasing your risk for breast cancer. But all said and done, of course, it is an extra exposure to hormones. So you just need to be a bit more alert and careful. It's not directly going to increase your risk of breast cancer otherwise, because it is done in a very, very, very guarded way.
Also, are there any breast cancers which are lumpless? Let's say, have you ever encountered a case where there was no lump visible at all, and yet that person
No
was
lump
having
felt at all, not possible. So when
not
you say
possible?
that no lump at all, it is only stage zero, which is
Hmm.
like a blessing. In stage zero, you don't have any lumps, and on a mammography, you've picked it up. But if
Okay,
it was not picked up at that stage and it progressed, it would have eventually caused a lump.
it would have. Right, right. Um, this is something which we had spoken about on our platform a couple of years ago, when men were also. It was there was some buzz created that even men are susceptible to breast
Absolutely.
cancer
So men do get
because they do have they do have
yes, they
nipples,
do have
they
breast
do
tissue.
have breast, yes, breast tissue. It's just that it's not developed because of their hormonal makeup of
Absolutely.
the body.
So,
So is that
one
true?
reason for it's absolutely true. So, one reason of breast cancer is, of course, the more the breast tissue, the more chances of breast cancer are there. That is why the incidence in men is less.
Right.
So, it's like 1%. For every 100 women getting a breast cancer, one man will get a breast cancer. But yes, men do get breast cancer. So, any lump in the chest area felt by a male person should always be evaluated.
Right. So even for men, how regularly it is important because see, we talk about prostate checkups. Dr. Priyanka, we lost you on camera. Yeah, you're back.
Yeah.
We
So
can see you.
basically, for men, breast cancer screening is not an option. It's not like prostate cancers because I said the incidence is practically nil. So for men,
Okay,
they just need to be aware that it can happen, and it is usually self-motivated. So once they feel something, that is how we reach to a breast cancer in men. So it's not like women that like prostate in men is equivalent to breast cancer in women. That is the level of screening we are trying in women.
okay,
But in
okay.
men, we are not propagating that they need to keep on checking it. It's usually going to be it's a flat chest, so you will in any case feel the lump pretty early than what a
Right,
female would feel. Yeah,
right,
yeah,
right. Any changes would be, caught up faster because
exactly. Yeah,
the
yeah,
breast
yeah, yeah.
tissue is very
It's just that they
important.
need to know it can happen. So sometimes they feel
Right.
that it's nothing because kya hi ho sakta hai. So they need to be
Yeah,
knowing it can happen, but then yeah, it's not that we
I
need
think
to
nobody in
encourage them.
India actually, not even majority of doctors also don't take men as serious
We're talking about
patients
doctors. I
for
sit in
breast
a
cancer.
cancer department, and of course I cannot name my patients, but I sit in a cancer department, and last month we had a male breast cancer. I have been sitting in this cancer department, and still the patient was questioned at three levels, right from security, that why do you want to visit Dr. Priyanka? She's a breast cancer surgeon. So I had to actually that day sit with my staff and educate them that boss, please don't make it more embarrassing for the men coming to our cabins. We have
Hmm.
been like we personally at this center also have treated a lot of male breast cancers.
Oh,
So it's not that we.
I
So it's
think
for any breast cancer surgeon. Yeah, they see
this
a lot of
part of
breast.
my this talk will be very
Yeah,
important while
yeah,
I
yeah,
share again this video. Like this video will get reshared
yeah.
in future.
Okay, yeah, yeah,
And
yeah,
this is
yeah.
a very important point because we haven't spoken about male
Male
breast
breast
cancers
cancers.
ever
Yeah,
in any of
yeah,
the videos which we have done for breast cancer. So
absolutely.
thank you so much for your input on this and also sharing a real life incident that how difficult even the surroundings make for a man
It's
to
difficult
like
for the
come up and
exactly,
say कि हाँ मुझे भी ये
yeah.
problem है.
Hey,
So
yeah, yeah,
right.
absolutely.
So I think doctor we have covered almost
I believe
all
so.
yes myths
Aspects
major
of
myths
breast
that
cancer.
we have around bras around DOs talcum powders wearing
Absolutely.
different sort of
Yeah,
bras, men having cancer, women having to go up and show around, get
yeah,
screened every year
yeah, yeah,
through
yeah,
an
yeah.
expert. And self
Perfect.
breast examination. I think, ladies, there are a lot of videos, even we have done a video, but you can go and just Google
You can
self
just
breast
Google it.
examination.
Exactly. I always
And you
tell
will find
patients,
so many instructions today, videos, which will
absolutely.
actually show
Yeah,
you how to do this.
yeah.
So please do that. Not around your periods, not before your periods, definitely not during your periods. After that,
Yes,
immediately after
perfect.
that, let's say 2 days,
A week
two,
after
three
that
days
is
after
perfect.
that would be the right time.
Yes.
Right. So thank you, Dr. Priyanka, for your time,
Thank
for
you so much,
sharing
Kritika.
your knowledge, your experience with us. And very
Yes.
grateful कि आपने अपने schedule में से स्पेशली हमारे लिए टाइम
I'm
निकाला
glad.
सब
I'm
सबके
glad.
साथ बात करने के लिए आपने टाइम निकाला. Thank you so much and have a great day to you and
Thank you,
everybody listening.
Kritika. You're a wonderful host, and thank you so much for the session.
Thank you. Thank you. Bye
Thank you. Bye
bye.
bye.